Alrighty, hello. My name is Emily Small, and I am doing my presentation over dissociative identity disorder, also known as multiple personality disorders. To start off, I'm going to be talking about the history of dissociative identity disorder. Now, the history of dissociative identity disorder dates back to reports of demonic possession that are now thought to be in incidences of dissociative identity disorder. Now, either way, it's clear that this disorder has a long history and it's not a new concept. So, there are many other possibilities back in the history. Also, it was first discovered in the 1950s after a movie was released, which was based on a true story. Now, let's move on to prevalence. Most current studies place the prevalence of dissociative identity disorder, or DID, between 0.1% to 2%, though a few give estimations as high as 3 to 5%. The DSM number 5 estimates that the 12th month prevalence of DID as 1.5% of the population of American adults, as set in American Psychiatric Association. Let's move on to symptoms. There are very many symptoms with dissociative identity disorder. Many have memory loss, they lose track of time. They go into many episodes where they can't remember anything, and their other personalities can take over for like a really long time, like without them even knowing it. They can wake up on just like a totally different day and not even know that they were gone. And they can have episodes of feeling unattached from their own body and thoughts, where they can hear talking in their mind and them not being sure why they hear it. Well, they're sure, but they don't want to hear it. Like, they can have like a million things going on in their head, and usually there's one person trying to be the leader of like the group of different personalities. Hallucinations. They can see things that aren't there. They can hear things or hear voices talking in their head like I just talked about. And they can't control it. They can't. There's a question to how long they can control their alternate egos. I mean, alternate personalities, but they can't control them. They just come when they come. There are usually 13 personalities that emerge, but in some cases there's 22. So that's a lot of personalities in one person's body that they can have. Treatment. The treatment of the DID is not a quick fix. It may encompass medications that treat anxiety and depression, but the true core of the treatment lies with psychotherapy, which can take years. Psychotherapy can involve individual group or family therapy. Here are some common elements to make treatment successful. So usually in psychotherapy, the goal is to try and get the switchings to stop when stress is really high, and to integrate the personality into a cohesive, stable personality. So that means getting all the personalities and putting them into just one gigantic personality, so you can just have just one, so you don't have to switch all the time. And let's move on to controversies. One component that makes DID difficult for some mental health professionals is to swallow is the theory of its casualty, which pertains to repressed memories. So some believe that the DID is just put on as an act to get attention from others, but that is clearly not the case. So other controversies are that you lose control of your actions is very much debated by therapists, particularly by those seeing disassociation as a hypnotic state. They believe that the DID is a result of severe trauma as a child. Repressed memories, it is common to uncover those memories, but is considered highly unethical today. The idea of DID is considered somewhat introgenic. Therapists one of the original cases that occurred in the 1970s in the MPD and the DSM in 1980 was a fraud. So some therapists believe that it's all just a fraud and that people don't really understand what's going on. So here's a picture of somebody that looks like they can hear the thoughts and see like their different personalities. And that's the end of my video. And here are my references. There's 1, 2, 3, 4, 5 references here. And that's the end. Thank you.